My friends, we are trucking the truth across America. Your Godzilla of the Truth right here, your commander of common sense. You're on the Straight Talk Express, where there's no gibberish, there's no nonsense. We bring you the action right from where it's happening. Now, right now is a big day. Repeal and replace Obamacare, poised to pass. Got a better bill than we had. Omnibus, that passed yesterday. Another crazy spending bill that Rob Wittman has been railing against for 10 years. One of these days, they're going to finally say, what is that Dr. Wittman saying down there? Maybe we should go actually hear what he has to say. And he's coming up right now. You're on the John Fredericks Radio Network, live from Washington, D.C. Crammed us in, and we appreciate that. Dr. Rob Wittman. Congressman Wittman is also the chairman of the Sea Power Subcommittee, lack of a better term, the pithy title of his commando operation going down there. And he travels all over the country to go to various naval bases and good things like that. Congressman Wittman, it's great to have you, man.
John, it's great to be with you this morning. Thanks for the opportunity.
Well, thanks for coming on off your regular time. And we're excited to have you on today because today's a big day. Now, number one, you texted me at 5 a.m. You said you voted no on Omnibus. Why?
John, for a variety of reasons. There were elements in this bill that I adamantly disagreed with. It did not place enough dollars into critical accounts for our nation's defense. We're still going to struggle to regain readiness, to make sure we get ships to be repaired, to make sure we get aircraft to be maintained. All those things are critical. It was lacking in this bill. Additionally, too, there were lots of things that were added to the bill. John, there were 24 instances where things were added to the bill, spending was added to the bill that never got through the committee process, that weren't in any of the committee appropriations bills, just ended up here. And you know, that is not the way this process needs to happen. We have all this time to do it the right way, to have these bills go through committee, to have them debated, to have them come to the floor, and then we end up at the last minute after, you know, two ridiculous continuing resolutions, which are, again, an application of our responsibility. And then here we are with a bunch of stuff that gets negotiated into this without any type of participation or transparency, and boom, here it is. So I'm just adamant that's not the way to do it. And if, you know, and I know folks, you know, say, well, gosh, Rob, you know, then the alternative is to do nothing. No, the alternative is not to do nothing. The alternative is to do the right thing and to get this done. And if we keep voting yes for this type of effort, then, John, we're never going to change where we need to be. And listen, I don't want to shut the government down, but I want to make sure that we are all standing and saying, no, this is not acceptable. This is not the way we should do things. This is not what needs to be projected in a well-thought-out appropriations bill that does what's necessary for our nation's military, that does what's necessary in controlling spending. You know, all those things, I think, have to happen in this process, and that's what frustrates me. It frustrates the American public. We have to be able to address the deficit and the debt. We have to be able to address our nation's military. You know, back in November when it said we're going to pass a CR so we can get to all these things, we can do that the right way, and then we end up not doing it by April 28th. All of a sudden, at the last week, that's when negotiations start. And then we do another short-term CR to provide more time so we can put something out there that, again, has been negotiated by a handful of people, that has all these elements in there that are just what's wrong with this decision-making process. And listen, I want to make sure that we continue government operations. We heard, you know, we don't want to shut down. I don't want to shut down, but I want us to do things the right way. And if we keep doing it this way, we'll never get to the point to make the tough decisions that we have to as a nation about how we control our spending, how we make the tough decisions to put money where it needs to go to places like national defense. If we keep doing it this way, we'll never get there, John. So that's why I was so adamantly opposed to this omnibus spending bill.
Well, you're right. Again, Congressman, and I thank you and applaud your courage for voting no. I know that's not easy. Morgan Griffith last night told me he voted no. I think Tom Garrett said on my show yesterday he was voting no. Dave voted no. Barbara voted in favor of it, and I'm not sure. I haven't looked up what Scott Taylor did, and I'm sure Chairman Goodlatte voted in favor of it. But look, you know,
no, actually, Chairman Goodlatte, I give Chairman Goodlatte credit. He was, I think, one of 3 or 4 chairmen that voted against the bill.
Really?
He brought up some of the things that I brought up, and that is, what was in the bill that didn't even come through the proper process, or anybody knew that it was in there. So Chairman Goodlatte did stand and say, no, I'm not going to vote for a bill that comes together this way.
Wow. Well, I tell you what, that took courage as the chairman of a powerful committee in House leadership. So we commend Chairman Goodlatte for that and appreciate it. See, that's what happens when you think something, right? You got to check it out. So we applaud Chairman Goodlatte for that. And I got scathing, rebuke on it when I opened my email box today from your colleague, Dave Bratt. He was not too happy with it either. And Morgan texted me yesterday afternoon, and said that he was voting no, that he went on and said almost exactly what you're saying now. So, look, Congressman, today, big day. We're getting to repeal and replace Obamacare. Now, I told you this last week or 2 weeks ago when you were on, and I said, I'm going to reserve judgment on this new amended bill until I hear what Congressman Wittman has to say, because you're not a member of the Freedom Caucus. You're not a member of the Tuesday group. You're a powerful subcommittee chairman, but I can always count on you for the exact truth no matter what. So you're in favor of it. Tell us why.
Yes.
Tell us why.
Well, John, I think the amendment that was made made the initial bill better. I was not in favor of the initial bill as it came before us, but I do think the amendment made it better because it gives states the ability to, if they choose, to replace their set of required conditions that health insurance covers themselves versus what the government says has to be done. The federal government, there's this thing called enhanced health benefits, which says this is what a health care policy has to cover. This bill gives states the ability to say, hey, listen, if we don't agree with what the federal government does, we can do it. Most states already have their own requirements on what conditions health insurance needs to cover. This gives them the ability to do that. There's also another provision in there called community rating, and community rating allows the assessment of healthcare premiums to be set based on the health conditions of the community. And what we have said is that there's actually a better way to do it. Maine used what are called invisible risk pools that allows them to be able to dissect individuals in the community's health status in different ways to be able to help bring down cost. It's one of the cost drivers there. So it allows them to place people into risk pools, which is the idea of making sure that you identify those costs, do that in an invisible way so there's no bias that creeps in with those individuals. And we saw in Maine that premiums came down on an average of $7,000 by doing that. Now, you also take some additional dollars and spread them throughout the pools to help where there is a loss of money in those risk pools because of people with health conditions that require more expenditures. So it's a good way to balance that. So for those folks that are in coverage now, as long as their coverage continues, pre-existing conditions there, those rates will continue for them to be the same. Now, the argument has been as well, Rob, why are you messing with pre-existing conditions? Well, we're not. The bill clearly says that pre-existing conditions, you still can purchase insurance and you still will be put into same rate categories regardless of your pre-existing condition if you continue coverage. Now, there's a group of folks that if their coverage were to lapse or they were to come in, folks argue, well, then states could charge a variable rate. In other words, based on what your health condition is, you could pay a higher rate. That is certainly possible. I don't think that states, first of all, would do that. If they did, the provisions in the bill, John, say you have to show that it brings down rates. It doesn't say bring down rates for certain people. It says bring down rates, continue to have access. So what was done, which I think is a good protection, is to say, listen, if the state were to choose to do that and somehow they had a variable rate, in other words, people with more chronic health conditions had to pay a higher rate, that there was money put in there to say that we would allow those additional rates to be covered by putting this money into the risk pool to make sure that, again, rates don't vary across certain health conditions.
Right.
So I think that's a great way to be able to take up that issue if it were to occur.
Right.
I think the likelihood of it occurring is very low. But if a state were to come in and make some compelling argument, and again, it's up to Dr. Tom Price to actually give that waiver, and it would have to be a very compelling case. If they were to grant that waiver, there are dollars there to say, okay, we're going to put some money in there to cover what potentially could be a variable rate there to make sure that folks don't have to pay that additional rate for their pre-existing condition. So I believe that all those issues, things that have been, what I think are sometimes misportrayed criticisms, I think we have covered all those situations with what the bill puts forward. It allows states to be thoughtful and innovative and creative with this. It does help us address the main cost drivers in premiums, John, and that's the key. This allows those issues to be addressed, and I think it will drive down rates, it will drive down cost, and folks will continue to have access to buy coverage.
So, Congressman Wittman, the $8 billion pre-existing condition risk pool amendment, taxpayer-funded money, that's going to go in. That presented by Michigan Congressman Fred Upton. Where does that $8 billion go? Like, it goes in a fund, and then what happens?
Right. It goes into a fund, John, and if a state were to come to the federal government and say, listen, we want a waiver for enhanced health benefits and community rating, and we come up with a different way to do this, and here's how we're going to structure this invisible risk pool. If that structure were to put in place for those folks that are either coming back into the insurance market or have never been in the insurance market, if there's a provision there to say we will allow the insurance companies to charge a different rate for you based on your health condition, which now everybody has to pay the same rate in purchasing that. In other words, you can't charge a different rate based on somebody's health condition. If that state were to come to the Department of Health and Human Services and say, we want a waiver and this is what we're going to do, and the Health and Human Services Department were to say, okay, we're going to allow you to do that. Again, two things that I think only under, I think, extreme conditions would even happen. But if it did, there would be dollars there to say, okay, we'll put dollars in there to make sure that these rates based on people's individual health conditions, in other words, their risk, we would make sure that those dollars are there to cover whatever additional cost may be incurred for folks coming into. Remember, if you continue coverage, your rates stay the same, period. But it's only for a very, very small group of people that would either be coming into coverage or whose coverage has lapsed, that those dollars would be put in to potentially, again, I think it would be rare that this would happen, but there is a place where it could. And if the states applied for that and that waiver was issued, and there was a variable rate for somebody with a chronic health condition, then these dollars would cover to make sure that their rate was the same as everybody else's rate and what they paid for insurance.
So basically, they would be subsidized, the same they are now, but the subsidy,
yes.
But the taxpayer's subsidy would be limited.
Exactly. The subsidy would be different, John. The subsidy would go towards those individuals, but again, the subsidy would be put in place, but overall the rates would be coming down because the application by the state would be to say we can do things differently, and again, they have to demonstrate that they will bring down rates.
Right.
So, for the overall effort of bringing down rates, if perchance that did result in a variable rate for folks with chronic health conditions, these dollars would go there to cover to make sure that those folks did not pay a higher rate. But overall, you'd have to show that rates were coming down. So there's a net positive. And what we're doing here is to make sure that we hold people harmless in case of a situation where overall there's a big decrease in rates, but a small group of people could be negatively affected. We're saying, no, we're going to protect that and make sure that doesn't happen.
Dr. Wittman, would not the state waiver system, which is basically, I like it because it's giving ultimate control to the states, which is getting a little bit closer to people, because this is about getting care for people. It just isn't a card to have. But wouldn't that eliminate any possibility of buying insurance across state lines and hurt competition? Because every state would have different rules, right?
No, actually, John, it would. The provisions for what we believe need to happen with selling insurance across state lines, I think actually can be enhanced by this, because now states are going to be thinking about, well, what will we do in our state? Insurers will then too look at it and say, okay, we can design coverage within these states, within these parameters, which right now they do, because remember, every state already has in place their own set of regulations, their own set of what's required to be minimally provided for in an insurance policy. This, I think, encourages states to be more forward-thinking, to look at markets within their own state and say, hey, listen, how can we make those things better? So I think, too, insurers will look at that and go, well, hey, there's going to be a lot more transparency, a lot more thought about not only what does this state do, but remember, states are now going to have to look at other states and say, well, is our insurance system competitive with other states? Because as they look to attract businesses, as they look to their state economies, if they can have a system, John, where rates are coming down, where they have good insurance opportunities in their states, that's an economic advantage to them. So I think with that element of marketplace, I think it's actually going to make things better and more competitive, and encourage states to be even more aggressive in looking at how they can drive healthcare costs down, and then being able to sell across state lines, opens up that marketplace and encourages states to say, well, hey, listen, there are a lot of insurers out there. What do we do to attract those insurers to our markets? Because they're going to be able to go across state lines. So I think it actually enhances the ability for states and for the idea of selling across state lines to work even more effectively.
Okay, so walk us through again. I've only got a couple minutes, but the big issue here, we get the pre-existing conditions. That's why I really think Upton's amendment made sense, and you just cannot kick people to the curb. I don't care what your philosophy is or what your ideology is or what your spreadsheet says. You can't do it. We live in a society where if somebody is getting care right now for a pre-existing condition and they're paying $100 a month, you cannot raise that to $1,900 or kick them off. You can't do it. We live in a society, Rob, where you just can't do that. So it's a senseless argument, and I'm not even going to go there. But here's where I'll go. Explain again to the average working American right now listening to us, going to work, that has been hammered by Obamacare on premiums. Explain how voting for this today is going to bring their premiums down.
Well, John, what this bill does is it addresses of the five major cost drivers, this addresses four of them. So what this allows us to do is to be able to bring those costs down. So if you have insurance now, that insurance is going to continue. The way the insurance is priced is going to change. Now, you won't see the change this year because the actuarial tables or how they figure insurance rates is already being put into place. But I think in 2018 with these changes, and again, how the system is restructured, how states can now, if they choose, come in and say, we're going to do things differently. We're going to create these risk pools. That's when you're going to see rates come down, because we actually take away many of the impediments that are pushing costs, or not impediments, but the impediments that keep costs from coming down, or the drivers that push costs up. So simply put, you have less of the efforts by the federal government that drive costs up will be in place once this bill goes into place. And remember, too, you got to go through the Senate. So the Senate's going to make some changes that will come back to a conference committee, and that will be finally what we come up with. So the Senate will have some different viewpoints. So this is really the starting point in that argument. But our whole focus, John, has been on what are we going to do to address what has been identified as the cost drivers of pushing insurance rates up. We want to make sure that people have the ability to choose, that they have the ability to buy insurance that's affordable, that fits their needs. And you remember before with Obamacare, you couldn't buy what you wanted. You had to buy what the government told you had to buy. And many times people said, hey, listen, I want to buy what fits with my budget, what fits with what me is an acceptable risk. And this also takes the limits off the health savings account, so it opens up the ability for folks to save their own money, to be able to actually put that away tax-free, to help in defraying their own health care costs. So we think this puts much, if I were to give one message to the average consumer, this puts decision-making back in the hands of the patient and the provider, and it drives down costs.
All right. Look, if it drives down cost, I'm for that. And the fact that it's not going to impact premiums this year doesn't matter because it's not getting worse, right? I mean, everybody's fear is it's not going to get worse. We can deal with it, then go forward. Premiums come down. And then we go to phase 2 and phase 3, which, look, all of us blew off the last time because phase 1 was such a disaster. I never believed in the other phases would come. But look, I know Tom Price for a long time. Congressman, he was my doctor. He was my oldest son's doctor. He was an orthopedist. When my son played basketball, he had some issues with his spine. Dr. Price did that. I was in his district forever, covered him forever. And if he says he's going to get this stuff done, he's going to get it done. I mean, this guy's, he's tough. So we like that.
And I agree, John. I think he'll get it done. And I think, too, that, we will continue to work on, making the system better. But I think this bill, in and of itself, even if nothing else happens, and I do believe Dr. Price will do a lot, but even if there aren't other additional pieces of legislation happening, I do think that this bill will have a positive impact, and that's what we're all focusing on is, positive impact, again, on people being able to choose and being able to bring costs down.
All right. Listen, we got to get this done. I'm in favor of it. You're in favor of it. I appreciate that in-depth analysis, Congressman. I know you got a lot going on today, and sharing that with our listeners, very informative. So you were one of its most toughest critics the first time around. Now you seem to be pretty excited about it. So I'm going to go with that. That's all I need to know. Congressman Wittman, thanks for being with us, sir. It's always an honor to have you on.
Thank you so much. Thanks for the opportunity, and thanks again to all your listeners. They've been very helpful as I have reached out to talk to folks across the political spectrum. We've spoken with literally thousands of people over the past several months and gotten a lot of great feedback, and I think that feedback, creates good legislation, which is where I believe we are today.
Okay, and we want to thank again Dr. Rob Wittman, who chairs the House Armed Services Subcommittee on Sea Power and Projection Forces. More information, whitman.house.gov.